Okay.
All right. Um, Good afternoon to everyone, depending on where you are watching us from. My name is Mariam Irama Williams. I'm your host for today's health discussion. So, welcome, Mr. Ifa. Please introduce yourself to us.
Thank you. My name is Ifa. Like I prefer to be called Ifa, so let's just go by that. I'm
Okay.
a registered nurse, and now I've dived into aviation. So, but I'll come back. I'll come back to the nursing maybe very soon.
Okay. All right. So today our topic for discussion is on kidney disease. So let's just dive
Okay.
it. So please, when we say kidney disease, in general terms, what is kidney?
Okay. So kidney disease, when we like, should I say self-explanatory? Because diseases of the kidney. So when we say kidney disease, it refers to any condition that damages the functions of the kidney. So one may ask what functions of the kidney are. So kidneys function one, maintain fluid balance and also to excrete toxins. So what happens is when we say kidney disease, like itching, that will hinder the activities of the kidneys.
Okay. And can you touch on this acute and chronic kidney disease? If you can briefly touch on the two for us.
Okay, sure. Yeah. So when we say kidney disease, we have two types, the acute and then chronic. So when we say acute, mostly referred to as acute kidney injury, which is a sudden drop in the function of the kidneys. And this mostly happen like within hours and then maybe some days. Yeah, and then can be corrected like if detected earlier. But
Yes.
if not detected earlier, then they can progress to the next form of the kidney disease, which is the chronic. Yeah. So they are usually reversible, like and sudden. Yeah. And we have the chronic, which is gradual. So let's say maybe you have the acute one, that one like sudden onset. Yeah. And if it is not detected earlier and treated, so it will gradually transform to become a chronic kidney disease. So that is the opposite of the acute. So gradual onset, long term, and a loss of kidney function. One mostly silent, or maybe the latter stages. That is where you will know that, oh, my kidneys have failed, or maybe they've lost a function. Yeah. The, the chronic one um, can be corrected, but they can be managed. Yeah.
All right. Thank you for that. Let's dive into risk factors or causes of kidney disease. Are there any causes or risk factors of kidney disease?
Yeah. 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 So every condition has the causes and then risk factors, like some contributing things that may lead to that condition. And kidney disease is not an exception. So there are some factors or some causes of kidney disease. Our number one risk factor may be from high BP, or let me say hypertension. Okay, so high BP, if it is just um, a sudden one, everyone can have high BP. Okay, like when yours become chronic, you are hypertensive. So let me rather use hypertension, okay, instead of high BP. Yeah. So hypertension. If you have hypertension, what is happening is um too much tension on your heart. So it comes from these two words, hyper, which in medical terms means like high or over, then tension, like the pressure. So the pressure of the blood on the vessels and also on the heart has gone up. Okay. And what the blood does is it pumps, what the heart does is it pumps blood to the various parts of the body, but then they go through the kidneys to be filtered. All right.
Okay.
So what happens is when your pressure is high, that means the kidneys are also receiving that high pressure.
Yeah.
All right. So if it's happening over some time, that means the vessels in the kidneys are going to some may even rupture. All right.
Okay.
And this will lead to the loss or reduced function of the kidneys. And sometimes too, like the pressure, the vessels is just like how should I put it? Let me give a classical example, like that we all know, like these plastic tubes, like the pipelines that we use in our houses. Yeah. So let's say you have the full diameter. When water is flowing through, it goes steadily. You don't really see the pressure much. But when you apply a restriction at the opening or something, you see that the water comes out at a very high pressure. So yeah, that is what happens because um, the total amount of blood, or let me say, if I'm using the water coming out, the opening is now restricted. Say Yokobo Suma, we see more often. Ọmụ ọmụhụrụ cars wɔ bowsuo no, wobɛsɛ sometimes ɔta hose no a, wobɛhu sɛ na ɔde ne nsa asi open ano kakra. Then the way a pressure no firi hose no mu ba no, wobɛhu sɛ asɛ ayɛ soro. So the same way, if you are hypertensive, the pressure in the blood from the heart is also exerted on the kidneys. So yeah, definitely they will make the blood vessels in the kidneys very weak over time, and then the kidneys will begin to fail.
Okay.
And then another one is recurrent kidney infections. So if it is an infection that is causing the disease, like I said, you may have the infection if it is not detected early, all right, and treated. Definitely it will progress from the acute phase into the chronic phase. And what happens is maybe it was detected, but it wasn't treated properly because some of us, we don't like taking medication. We go to the hospital, an infection is detected, we are giving the medication. After maybe 2 or 3 days, when we start feeling better, then we stop the medication. All right. So definitely the infection will reoccur. Okay. Yes. And at this point, it will be more potent. Now, what the cause said you're not at the end. So if you are someone who is prone to this, like you keep having recurrent kidney infection, definitely, yeah, you may have your kidneys damaged over time.
Okay.
Yeah. And you also have diabetes. Diabetes works hand in hand with hypertension. Like
Yeah.
we, the health workers, we know that diabetes can cause hypertension. Hypertension can cause diabetes. So yeah, if you're having hypertension causing kidney failure or kidney disease, that means diabetes too can cause it. And then another factor, use of nephrotoxic drugs. So nephrons, they are structures found in the kidneys. So if then we are saying nephro means medications that are toxic to the nephrons.
Yes.
So if you are also someone, and sometimes we do it because today I was sick. When I went to the hospital, the doctor gave me this medication. Tomorrow I am sick. And we know that some conditions they present the same like similar, not same,
Yeah.
but similar symptoms.
Yeah. Yeah.
Yes. So when the person begins to feel those symptoms, the person may be thinking, oh, you get it.
Yeah.
Last time on the man.
Yeah.
Yeah. So sometimes you have people, I've seen people treating maybe fungal infection with antibiotic.
Yeah.
You get it? Yes.
Yes.
So wait, wait, dear, mama mbo mochi kakra. Um, infection back one mutenya is candidiasis. All
Yeah.
right, they're a friend of whiting,
Yeah.
and that one is a fungal infection.
Fungal infection. Yes.
But yes, but you see most people treating it
Taking
with an antibiotic.
antibiotics.
A common a year AC.
Yeah.
So yes, if you don't know the type of antibiotic that you are using, because ABA some time ago when you have some infection be one horn or call a man, this antibiotic intino was in your bioma my unknown sadruna. So if you do that, you are posing threat to your kidneys. And then another factor, autoimmune conditions. So the autoimmune condition we know is the lupus. Lupus, when we say lupus, lupus is when the body cells like they begin to attack themselves.
So yeah.
They said you want gas out to home and maybe
Yeah.
something like that. So sometimes it is a rare condition, but it does happen. So sometimes the body cells they begin to attack themselves. So when we have this lupus happening in the kidneys, they can definitely cause the kidney disease because they will attack the cells and the tissues of the kidneys. And then, yeah, that will lead to the kidneys losing their function. So these are some of the causes and risk factors of, and also family history. You know, you can't do without this. Like it's almost everywhere. BBA family history. And this ABA Busuani will be you also stand the chance. This one here, which is the risk factor. Yeah.
Yeah. Okay. All right. Thank you. Are there any lifestyle causes of
Yeah, lifestyle causes. Yeah, sure. So if you followed what I was just saying when I was touching on the risk factors, I made mention of use of nephrotoxic medication. That one is a lifestyle, you know, um, relying heavily on over-the-counter medications. So yes, because today I was sick, the doctor prescribed this medication to me. Tomorrow, if I am sick, I'm just going to the pharmacy to get whatever medication because maybe I'm eating a and I'm a coy and more into your so BTM I'm a quacoto I'm just citing an example. So
sure.
that one is a lifestyle. Okay. So yeah, some of the lifestyle lifestyle causes of kidney disease, we have excessive salt intake. Excessive salt intake, like too much salt draws more more water into the blood. Okay, so what happens is if you're taking too much salt, the sodium is absorbing more water. And what will happen is it will increase your blood volume. When the blood volume is increased, your blood pressure is increased. So one thing is leading to the other. And when your blood pressure is increased, we talked about hypertension, the cause of the kidney disease. So definitely from that intake, you can also get the kidney disease. Um, use of herbal medication, no, it's just like the over the counter. Um, it's rather unfortunate how these are herbal medications, like unlike downplaying the potency of herbal medications. But the thing is, you need more. Okay, you need more to achieve a result. So it happens like maybe yare bi a ɛwɔ wo so and wobɛno yare no bɛkɔ no ɔn sɛ ɛno no it take gradual process, like a healing slowly. Nti ɛgye sɛ bi a wanom bɛyɛ 3-4 bottles ansa na ebi a ɛbaako bi. And see how the bottles are very big. That one, alcohol misuse or alcohol abuse, and then smoking, like this lifestyle, and also if you are obese, yeah, most times obese people, you know, one of the causes of hypertension is obesity, so that one too can lead to that.
Sure.
Yeah. So our lifestyle, yeah.
All right.
I want to touch on the obesity, how to calculate your BMI. Okay, so BMI is actually body mass index. So body mass index, if you want to calculate it, your weight in kilogram, okay, into umudro, ebi akɔ hospital, yesi bejina scale no so, yewo di enti ayema wujina so, emfaso wo so yebe here. So your weight in kilogram, then you divide by the square, okay, the square of your height in meters. Okay, so square of your height in meters, let's say your height is 175 centimeters. So 175 centimeters in meters will be 1.75 meters. So that one, you are going to square it. When we say square, you are just multiplying the number by itself again. So let's say you weigh 60 kilogram. So it's going to be 60 kilogram over 1.75 times 1.75. Okay, so the value that you are going to have, if you do that calculation and you have it, the value less than 18.5, you are underweight. All right. And if you have it between 18.5 and 24.9, that one is normal weight. And me skinny, but me normal weight. No one should come after me. All right. And then if you are over 24.9, that is 25 to 29.9, that one is overweight. Unye obese. Meaning say so many people, especially our loved ones, you the ladies, you are so much like concerned about my weight. So I'm doing this for you, at least a Christmas gift. We can call you obese if your BMI is greater or equal to 30. So weight, now you divide it by the square of your height in meters. Now say your value a equal to or greater than 30, then that one we can say that you are obese. But if you have it below 18.5, you are underweight. And then if you are between 18.5 to 24.9, you are normal weight. Normal weight. Then overweight is you will be a cancer also. And you will be your obolo. Obolo no na you obese no. But overweight maybe a nipa also an animal. Yeah. Hormone between 25 to 29.9. Yeah. So at least some people are much concerned about you can't obesity being the cause. If you want to know if you are obese or not, a simple calculation to know your BMI.
Sure. And there's a calculation you can do yourself. What provided you have
Yeah,
the body of
provided you
the
know
height and
these
the weight.
parameters.
Yeah, you
And
can do it
I
yourself.
think most of us know our weight. But if you don't know your height, just check on your Ghana card. Okay.
Exactly. It's on the
Yeah.
Ghana card.
Check on your Ghana card. Your height is on it. Until at least you can do it yourself, and then you will know if you are underweight, you are normal weight,
Weight
overweight, or
or
obese. You will
obese.
know it.
Sure.
Yeah. That would way the we then.
Yeah,
We
normal weight,
overweight.
but no, I'm not.
We overweight.
Yeah, normal weight, but
Me to me your normal weight, my own your normal weight, Debbie.
okay, all right. You can now see the link. I mean, this can lead to this, and this can also lead to that.
Yeah. You
Yeah,
know, in medicine, when you're doing medicine, like you'll be treating this condition and then you get to a particular stage, they will bring in another condition.
yeah,
Yes, because one may lead to the other and the other may lead to the other. So you
yeah,
may end up doing maybe three conditions under one condition. Yeah.
yeah.
So I think I already touched on that,
Yeah,
um, the link. So hypertension and then kidney disease hand in hand. Okay. Because of the too much pressure from the heart. Because the heart is under pressure. And here now pump blood knuckle. Kidneys never share. You get it. So yes, eventually the kidneys will get damaged out of it. And when the kidneys get damaged too, now the fluid stay in the body. And what happens is they put the pressure back on the heart. So they are working hand in hand.
yeah, exactly. Exactly. Okay. All right, so let's move on to some myths or claims about kidney disease. So the first one is that you will know if you have kidney disease, and I think you mentioned that during the introductory part of how late you will know if you have kidney disease. Usually, you don't get to know when it starts. So that is one myth or claim that is on the streets. So I'll leave you to elaborate on that a bit more.
Yes, I don't know. This is taking me to another chapter under kidney disease. So
Yeah.
there are stages, and some of the stages, disease is silent. It's just hypertension. Okay, you may have hypertension, or let me say high BP, but you don't know until it strikes. So the same way, kidney disease, depending on the stage, mostly, if not maybe you went to the lab and they asked for kidney function test that it revealed that, or maybe there's been a reduction in the function of the kidneys. They are silent. Yeah, let me put it that way. They are mostly silent, especially like first three stages. Yeah, first three stages, they are silent. And it is just at the latter part that is when you know that, oh, I'm in doom.
Okay. All right. So the next one, the next claim or the next myth is that the only treatment for kidney disease is dialysis.
No, that is not true. So dialysis comes in at the latter part. That is when the kidneys have completely, like almost lost all their function.
Sure.
Because what the kidneys are supposed to do now, they can't even do like should I say 1/10? They can't even do like 1/10 of it. So yeah, when that happens, definitely you need an extra support. So it dialysis is not okay. Dialysis is not the only solution to kidney disease.
Okay.
If it is earlier, like, they can be corrected with some medications and lifestyle modification, but the end stage dialysis.
Okay. So now it will bring us to what is end stage renal or kidney failure or disease.
So just as the name suggests, end stage, like it has ended. So now the kidneys have more or less ended their life. So they've lost, when we say end age, it occurs when the kidneys have lost, it has lost greater than 90%. That means it's not even able to do 1/10 of its function. So, like, that is the end of it. We call it the end stage, like the last stage of the various stages. We have 5 stages. So, the end stage is the fifth one. Yeah. So, when it happens, then for that one, that is where the dialysis comes in.
So can you briefly touch on dialysis for us? What is it? We see it all over. The cost for dialysis is high, this, that. What is dialysis?
Yeah. So, dialysis is a special machine, okay, perform the function of the kidneys for you. What is happening is now your body, your body is the kidneys. They are unable to filter the blood for you, and you have the toxins running through your body. They can't be there with, all right, else they will lead to different form of conditions. Okay, so the machine just made to perform the function of the kidneys. So you go in, they will connect some tubes to your veins and arteries, all right, and then made to run through your body just like it will filter the blood off the dirt in there. Okay, like put back in there for you. So just like how the kidneys would have done naturally for you, now you are getting it done artificially. And the cost of it is high, yeah, because um we need to maintain it. Also, in our country, we can't manufacture it. So a whole lot of things come into play when we are talking about the costs of the dialysis. A whole lot of factors. These machines are manufactured from outside. They are brought here, and if you get it at the government hospitals, I know they are tested so kakranti and on cry. But if you go to the private facilities where obi na din on one kasani bottom sika akwa they have, you can imagine. Yeah, so the cost of it is actually high. That one, yeah, it's
Yeah.
actually high. So why should you wait to get there? All right, yeah. Why should you wait to get there? We should
So
try as much as possible to at least,
take care of
yeah,
our
not get to that stage.
Okay, so we are in the festive season or the Christmas season, and I mean during this period, there's a lot of outgoings, go out. have fun and all that.
Yeah,
So remember, whilst you are
you
having
are one of them.
fun, you should know that your kidney's health is also at stake. So we want some
Yeah.
tips for a healthy kidney. Whilst we are in the festive period, what are some of the tips we have to take home in order to ensure that our kidneys are not damaged?
Yeah. So when during Christmas there are a lot of food drinks. All right. Yeah. And those of us who know how to take alcohol, we may want to go so hard on alcohol. Yeah, I'm not saying don't take alcohol, but please minimize it. Okay, because when we were talking about the lifestyle
Causes.
um causes, we made mention of alcohol abuse. So yeah, if you are going to do alcohol, do it, excuse my word, wisely. Okay, like have your kidneys in. Yeah, do it wisely because you see some people are even selling one of their kidneys and then making millions out of it. So what their own per crown now. Said you be there be obi betimi aba beto wo de ne ba kwenti no. But kidneys no ho by my.
Yeah.
And then yeah. So um in our country around this time we have very dry weather. Okay. A percy, a bo. So definitely yeah. Dehydration a very high. So we shouldn't forget to hydrate as well. Yɛnum nsuo bu ɔnyɛ den baabi abɛfa bi a nsuo abu sika ni ho kora mpo a woba fie a nsuo yɛ ebi wɔ hɔ no anaa wokɔ adeɛ bu bi fa gu bottle mu ebi a hye na yɛbɛyɛ but ɛyɛ sen sɛ wonom bi koraa
Yeah.
so yeah yɛdidi a yɛnom nsa no na yɛnom nsuo nso because mɛnka nkyerɛ wo ho sɛ ebi a manom nsa nti no anaa manom drink nti no meyɛ okay on water. If we are being truthful to ourselves, wobɛtumi anom tea awie but na wote sɛ nsukɔm de wo. Yes, nti no deɛ yɛde nsa yɛ no wode nsuo yɛ a ɛnyɛ yie. So yɛdane no wɔ ha deɛ wode nsa bɛyɛ no wei no deɛ wode nsuo yɛ a deɛ yɛde nsuo bɛyɛ no wode nsa yɛ a ahanom ɛnyɛ yie so yɛ wonom nsa no a mɛnka sɛ because sɛ manom nsa nti no ɛyɛ liquid ɛyɛ fluid nti na ɛyɛ okay no please let's try and also take in more fluid like water.
Water.
It's just easy.
Yes. So in a day, how many liters is an individual supposed to take? That's for the water.
Yeah, so we are advised to take between 3 to 4 liters a day. So 3 to 4 liters, maybe are guilty of it. All right. I know a lot of people are guilty of it. Sometimes you owe it to you're busy and man, yeah. So what happens is I remember back at NTC, your tutor about and say before your body will tell you that you are thirsty, okay, say far it is just 1/3 and our body never can choose it. So that means before the body will tell you to drink water, not just like are you serious? Okay, so you shouldn't wait till you are feeling thirsty. So just make it a habit. It's easy to calculate. Okay, Ghana sachet water agu bebree. It's easy to calculate the amount of water you've taken. Okay, in a day because Ghana yɛnsuo no the cheaper source ɛyɛ sachet one and wofa sachet baako biara ɛyɛ 500 ml. So 500 ml no 8 ɛna ɛyɛ 4 liters, 6 ɛyɛ 3 liters. Nti wonum 2 biara ɛyɛ 1 liter. So at least sɛ wonum nsuo no koraa na sɛ wokan a ɛnɛ manom sachet like dodoɔ sei you can calculate for yourself say what do 3 to 4 liters na anaasɛ wonya nduru. You can do more, but at least unya 3 to 4 liters now. Okay. And then there will be food, like abundance of food. One will be crowd Christmas time. Yeah. So ye didn't so now the amount of salt we are putting in them. Okay, because salt can lead to high BP, which can later lead to Yeah. And then um we can also, at least I know, say, um when it gets to festive seasons like this, some hospitals, some individuals, they take it upon themselves to do like free health screening for people and others. What is a big also of our gym? Why? Go there. Yeah, go and
Yeah.
get checked. At
Yeah.
least, if not for anything, I know say if not for anything, will BP there better care.
Mm-hmm.
Yeah, you better check your BP there and your glucose level, so
Yeah.
that at least you will know the two causes. No, we talked about hypertension, we talked about
Diabetes.
diabetes,
Yes.
and it's when you're two-way put down, at least you're good to go. Ubehu now the what the another so if you, yeah.
Mm.
I think
Okay.
we can do this Christmas. Just tell yourself, just like we have New Year resolution. O set BB man fashion on say Christmas Eve there. Me so may say
Okay.
yeah.
Okay.
We mentioned smoking as one of the causes when we were touching on the lifestyle.
Yeah.
So yeah, I know it's going to be joyous, like a whole lot of fun during the Christmas. So please, yeah, since it can also cause damage to your kidneys, please, okay, take it easy on it. Just
Sure.
as you are taking it easy on alcohol, yeah. What you are not going to take it easy on is water. In so need the man fan hon chen. Bobo bima hon to. But for salt, for alcohol,
Alcohol.
smoking, and only they take
Yeah.
it easy. And only they,
Yeah. Yeah.
uh-huh.
And the
But
fatty
about
food,
you so need the young konkwan.
fast foods necessary, and also let's take it easy on it. I mean,
What?
fast foods,
Fat
fatty
food,
foods.
yeah.
Yeah.
Yeah,
Yeah. Yeah.
yeah.
Those things.
Yeah. So that one, Papa say Christmas. Yeah, Christmas. Nnuane no bebree bɛkɔ akɔyɛ sɔkyen
Yeah.
sɔkyen no.
Yeah.
You get
Yeah.
it? Yeah. So that will lead to us saying that you shouldn't forget to exercise. All right.
Yeah.
So yɛdi buro nya deɛ, but ahoɔden ni hɔ nom a wontumi ndi buro nya no bi. So what I say? Yɛho
Yeah.
obi a yɛano aduane abrɛ no kama, but ontumi nni because ahoɔden no nni hɔ. Nti sɛ
Exactly.
wobɛdi buro nya no adi ne yie deɛ a, oh, now we exercising so they are opumuden no ho adwuma so that ɔmo di a wobɛtumi adi because I don't think so ɔyɛ ayɛ a wobɛtumi adi wɔn mu ato a yɛdi koraa na like sente no koraa bɔn nti
Exactly.
yeah.
Okay. Okay. All right. Okay. All right. So we've come to the end of today's discussion. Thank you for
Okay,
raising our invitation. We are very, very grateful. And
yeah.
I hope you watching us as well, you've also enjoyed it. So we'll see you in our next video. Bye.